and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Tonight on the show, we're going to be looking at the latest developments in the management of the COVID-19 pandemic. Now, as of Monday, Putrajaya is no longer allowing entry into Malaysia for long-term pass holders from 23 nations that have recorded more than 150,000 cases of COVID-19. These countries include the US, the UK, India, Philippines, Indonesia, Bangladesh, Pakistan and Saudi Arabia. And these are not general tourists, but long-term pass holders, meaning that they have an existing relationship with Malaysia. Some of these countries even share a border. Now, the other recent development which might reveal a potential blind spot in our management of the pandemic is the emergence of yet another cluster at a detention centre, the Benteng LD cluster. To help us think through these issues, first up, we have joining us via Skype, Azrul Khalib. He's the CEO of Gallen Centre for Health and Social Policy. Azrul, good evening. Thank you so much for joining us tonight. How do you understand the rationale behind the entry ban of these listed countries?
Well, the rationale that we've been told by the government is that because there are currently spikes in cases that are occurring in different countries around the world, and also a potential surge in cases due to the winter period, therefore this travel ban is therefore necessary to protect the Malaysian population from further spread of infection via imported cases. But the problem here is that this travel ban has serious repercussions that should be viewed with utmost concern. I really worry whether this is an own goal which will actually work against our efforts to rebuild the economy amidst this outbreak. And the reason being is that it comes with multiple issues besides just the COVID-19 threat. The business community is already worried that this will result in many of the employees being stuck outside the country, and it's further hampering business activity for no other reason than being the wrong nationality. And then there are also serious concerns on issues such as Malaysians with foreign spouses. And it has been more than 5 months, for some it's even longer, and there's been forced family separation at the time of this pandemic, which is exerting a mental and physical toll on these women and children, and certainly irreversible trauma. So there are concerns now regarding citizenship, inability to register marriages, pregnancies which are coming to term with children being born and unable to be registered properly due to the spouse not being present.
Azrul, if I can interrupt you for the moment, I understand, the implications beyond the health concerns, but if we focus on the health concerns itself and this idea that 150,000 cumulative number of positive cases, they're not necessarily people with active, the disease, but just positive cases, is sufficient as a marker for what a country might represent as a risk to us. Does that make sense to you? Because this is a cumulative number, this is not most recent numbers, and countries vary in size. India has over 1 billion in population, and then we have tiny countries with much less of a population.
We're trying to understand why this number was brought about, but also we understand from the disease itself, it doesn't care what we did yesterday, it cares what we do today. And the cumulative numbers really don't represent that much more of a threat than what it is already today. Meaning every country that has a case of COVID-19 could be very much treated equally, because that involves citizens coming into the country. So right now when they say it's 150,000, as you say, it doesn't seem to make that much of a difference if it's between India or the United States, the UK or some other. So it is right now more of a convenient number, I believe.
Well, what about, Azrul, what about our testing and quarantine measures? That was said to be the SOP to allow entry, right? Are those not enough? Are those measures not enough to allow for these long-term pass holders to re-enter Malaysia?
Well, I can tell you this. Let's put this travel ban into context, right? If it was implemented during the MCO period at the very beginning of the year, it would be acceptable and necessary, because there were too many unknowns And it was important that we flatten the curve and buy time to ensure that our public health colleagues were able to prepare, respond, and treat cases as they come in. Today, we know more about COVID-19 as a disease, have those diagnostic tests that you just mentioned, and protocols for quarantine. So I would ask, are they not adequate? Haven't they worked so far? And I express my confidence in our ability of our public health professionals, the Ministry of Health, to be able to do their jobs, to be able to help screen and quarantine these individuals who need to be if they want to re-enter Malaysia. I mean, let the SOPs work. Let these protocols work rather than adopt this fortress mentality.
Azrul, do you think the media is not asking the government enough tough questions?
Well, I certainly watch the press conferences when they come up, and I always wonder, why are they asking this question? I'm talking to the television set, asking they should be asking this and so forth, But I think there needs to be a much more rigorous examination of the measures that the government has put into place. We don't want to second-guess the government for no reason at all. We want to be able to ensure that the right decisions are being made for the best interests of Malaysians. And I think the government itself has its heart in the right place. It's just a matter of ensuring that we are able to achieve that balance that we need, especially when we're trying to rebuild the economy.
Well, the other thing, Azrul, another development has been the emergence of yet another cluster in a detention centre, the Benteng LD cluster, and I'm wondering whether we have learned from the lessons from detention centres, whether there's something about the LD district police station, Tower prisons, whether the environment of these detention centres make it likely clusters. Are these blind spots in our management of the pandemic?
The detention center clusters are not unexpected. We've learned from other countries around the world which places are potential, which are vulnerable to outbreaks of COVID-19. And detention centers have been from the onset identified as such. Malaysia is not an exception. So in case we forget or forgot, the COVID-19 clusters immigration detention facilities, such as Bukit Jalil, was due to persons being detained who were infected and brought into that environment. It is extremely hard to implement COVID-19 SOPs in detention facilities as they are confined spaces with limited spacing possible, with detainees mingling in close proximity to each other. I would say that each prison and detention facility in the country should be monitored and screened for COVID-19. And I would say, and I would estimate that there are many more such clusters that are waiting to be discovered.
Right, Azrul. So, the media reported that the Director General of Health pointed to tightening border controls. That seems to be his takeaway from the Benteng LD cluster. But you're saying it's actually the institutions, in some sense, institutional failure to look at these detention centers. What really is the main thing that the government has to do right now?
Well, first of all, we have to move away from this mindset that this is more of an external threat. COVID-19 is in the community. There is already community spread of the virus, and the proof of that is looking at the number of unlinked cases that have emerged over the past month or so. We can see what's happening in Kedah, for example, all indicative that the outbreak is already in the community and managing it is key. So what is very important for us in order to succeed and to pull through this crisis, we need to make sure that the SOPs work for us, not against us. And adopting a fortress Malaysia mindset would be quite tragic because it would work against our best interests. So the institutions need to ensure that it recognizes that we are in a public health emergency, not a national security emergency. And the tone and messaging must be changed to adopt that approach. Because right now, we need people to cooperate. We need people to understand why they're doing their SOPs, and most importantly, to protect themselves and others from getting infected. You can't just expect people to mindlessly follow, the SOPs without a clear understanding of why.
Azrul, thank you so much for speaking with us tonight. We really appreciate you coming on the show and sharing your insights. We're going to take a quick break, but after this, we will be joined in the studio by Dr. Khor Kheng. He's one of the founders of the advocacy group Malaysian Health Coalition. That's all coming up in just a couple minutes. Stay tuned to Consider This. Hi, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. Now, it's been more than 6 months since the MCO was first declared in mid-March, and the government's public health response has really evolved over that period as both the scientific community and international health authorities have learned more about the virus and the disease that it causes. Now, earlier in the show, we had Azrul Khalib from the Gallen Centre of Health and, let me just get this right, of Health and Social Policy. It's Gallen Centre for Health and Social Policy. And in that conversation we had with Azrul, he made the suggestion that we need to make the distinction between a public health crisis and a national security crisis, and that adopting a Fortress Malaysia type policy will have tragic consequences. So to continue this discussion tonight, we have joining us in the studio Dr. Khor Kheng. He is one of the founders of the advocacy group, the Malaysian Health Coalition. Swee Kheng, thank you so much for joining us on the show tonight. Now, I'd like to start broad and get a sense of how you think the Malaysian public health response has really evolved during this period, the past 6 months.
Melissa and Sharaad, it's a pleasure to be back. It's evolved in a couple of ways. The first way in which the public health response has evolved is in response to the increasing amount of science and facts and knowledge that we have about the disease. And that has given us a bit more of an evidence base for us to craft policies, both public health as well as economic as well as security policy. So that's one way in which it's evolved. The second way in which it's evolved is the fact that previously we were very focused on a domestic response within our national borders. And now we have to consider what we do with the international community. And sometimes this requires us to consider how we interact with our neighbors. For example, can we share more information with them? Can we share health capacity with them? And can we establish a regional travel zone for Southeast Asia? Which is why it's somewhat surprising to see the Malaysian government's blanket ban on the number of countries in which they are not allowed to come into Malaysia. And a third way in which it's evolved is for us to focus less on the domestic, but now on the global, forget the movement of people. The third way is to consider global public goods. So for example, vaccines and treatments, and also what we do whenever we have new test kits, and how do we integrate these new technologies, and how do we share the patents for these technologies between Malaysia and the rest of the world as well. These are the ways in which the public health response has actually evolved away from a very domestic focus towards a more international and regional focus.
Swee, what about the question of communications? I mean, not simply from government to the public about what it needs to do, but also to the scientific community here, and in terms of discussions with stakeholders about public policy choices that are being made, almost in real time.
Well, this kind of public policy choices needs to be made together with the health experts. So we'll have to begin with that consideration that this is a public health crisis. However, the contours or the borders or the barriers, not barriers, but rather where does a public health crisis end and a security and an economic and a welfare crisis begin? And these are important considerations for policymakers. I like what Astro said about Fortress Malaysia. Let me build on that a little bit by saying that there is a way for you to securitize a health problem. For example, migrants and refugees can be considered an economic and political problem, but yet we view migrants and refugees as a security problem, and that security lenses can also be applied sometimes very unfairly and ineffectively to the health crisis that we have today. So the contours of where a health crisis begin and where an economic welfare and security crisis begin as well, I think are important considerations for us.
So that 23 country on the list of, an entry ban for long-term pass holders, does that make sense to you?
Not really, unfortunately. On a superficial level, it might. It might because we do want to restrict the entrance to Malaysia for countries that are quite severely affected by COVID. So it does make sense on a superficial level. But you scratch a little bit under the surface and you're thinking, firstly, some of the countries in the list of 23, like India, has 1.4 billion people. Yes, 150,000 cases, but 1.4 billion people. So what about the percentages? Because a country like Chile has only about 18, 19 million people. So it doesn't make sense to only look at 150,000 cases, but you should look at cases per million population, cases per number of tests. What about the curves and whether or not these curves are actually speeding up, plateauing or slowing down? These are important considerations for us to decide rather than just looking at one number of 150,000.
Yeah, and it seems also that we're looking at long-term pass holders. So these are people, so we're not talking about the general population of a Brazil or a US or the UK, but long-term pass holders. And surely the SOPs of people coming in, the quarantine and testing, would be sufficient to deal with the possibility of infections, right? So, or is there a doubt on part of government about these testing and quarantine regimes that they've set up themselves?
Well, there are 6 categories. For example, Malaysia, my second home, or long-term pass holders or professional visits. They also banned the spouses of Malaysian citizens from this country. Another disconnect, shall we say, is if you're a citizen of Brazil, for example, but you've been living in Thailand, for example, for the last number of years, why would you disallow a Brazilian living in Thailand for the last 10 years and have not returned to Brazil in the last 10 years to come into Malaysia if there is a good reason? And Thailand has, in total, 3,000 cases, approximately 3,000 cases since the pandemic began. So these disconnects, Sharaad, even though they are arbitrary, shall we say, bureaucratic distinctions, might not make sense if you apply them in real life. Your question, Sharaad, is more about the testing capacities and the health system's strengths of this country.
Yeah, wouldn't that be insufficient? I'm saying, rather than, you know, a kind of profiling approach,
Right.
why not just believe in your own testing and quarantine system?
That is true. It's unfortunate, shall we say, that the criteria to decide which countries cannot come in, which is an interesting one, why don't you just decide on which countries can come in instead of which countries can't come in, must rely a lot on the systems in Malaysia, but also the countries in which the person is residing or is from. Again, I think the citizenship narrative is arbitrary. The virus has no passport. It doesn't care which citizenship, what nationality you belong to. So therefore, the country of residence is more important than the country of citizenship, shall we say. So therefore, for example, if you're living in Thailand and Thailand's system is pretty good, maybe we can then allow this person to come in. Back to what I said earlier, the creation of a bilateral bubble between Malaysia and Singapore is currently in progress. Hong Kong has announced that they would like to create a travel bubble between Malaysia and Hong Kong, and we should consider really a Southeast Asian regional travel zone wherever possible. So that's more of an opt-in rather than opt-out approach. Instead of banning people, maybe we should consider these are the countries that we can allow people to come in.
Okay, so the ban on the entry ban was one of the newest developments. Also was the emergence of the new cluster, another cluster in a detention center. We're going to come back and continue this conversation with Swee Kheng after this, talking about these new developments. So stay tuned to Consider This. Welcome back to Consider This with me, Melisa Idris and Sharaad Kuttan. We're chatting tonight to Dr. Khor, one of the founders of the advocacy group Malaysian Health Coalition. Let's talk about the Benteng cluster, because this was within the Lahad Datu District Police Station and the Tawa Prison. And I'm wondering, because we also saw that cluster in Bukit Jalil, the Bukit Jalil Detention Centre, are these clusters a sign that there has been failure on the part of institutions to really practice the SOPs that have been put in place?
In short, Melissa, perhaps the answer is yes, but it requires us to dissect and unpack this a little bit. So we'll begin with some brief statistics. Prisons, we have about 70,000 prisoners in Malaysia within Malaysian prisons, and Malaysian prisons are 130% over capacity. So we're budgeted for about 55,000 people, and we've got 70,000 people inside Malaysian prisons. So even before the pandemic began, we already have a problem of overcrowding within prisons, which then the virus, clearly in overcrowded situations, finds it very easy to spread. So the problem started even before the pandemic. And when you then consider of the 70,000 or so prisoners that we have in the Malaysian system, approximately 50 to 70% of them are there for minor drug offences. Now, perhaps we shouldn't look at what the definition of what minor is, and I don't want to get into that conversation, but there's always been a debate here about whether or not we should securitize the drug problem or medicalize the drug problem. What I mean to say is, when you have a drug offender, is it a crime or is it a medical condition that requires help? For example, psychiatric assistance or methadone replacement, putting them or giving them access into the healthcare system.
Yep.
And many people have actually talked about giving the prisoners of minor drug offences more access to the healthcare system and take them out of the prison so that we can decongest the prisons.
Right, and I think this was a conversation that was sparked by the Pakatan Harapan government and the Minister of Health at that time. But Swee, coming back to the present, I mean, what we have seen over the last 6 months is some countries have in fact released prison populations. So this is not extraordinary, at least when you look at the global picture. Is that something we could do now and that would actually be beneficial in the long run? We talk about the numbers of, minor offenders. Could that be a solution if, in fact, this is going to be, we're looking at more clusters happening in our prisons?
Absolutely, and I'm supportive of this, Sharaad, for public health reasons because it reduces overcrowding. I'm supportive of this because of ethical and religious reasons because we're treating them as human beings and giving them dignity. I'm supportive of this from a criminal justice system as well because the punishments need to be proportional to the crime, and I'm using air quotes for the word crime because possession of even 1 or 2 grams of a particular drug gives you a very high punishment very, very quickly. So I'm supportive of this for very many reasons, but it's also very pragmatic. And some of the countries off the top of my head that have released prisoners during the pandemic itself have been France, Italy, certain states in the United States, Ireland, Chile, as well as Iran, Afghanistan and Somalia as well. So it's a host of countries that have actually released prisoners. Obviously, we need to build a system to release these prisoners. Minor offences, for example, however you define minor, people who are older, for example, and therefore at higher risk, or people who are nearing the ends of their sentences, and maybe these are the 3 categories that you can quickly, I won't say quickly, but appropriately release them to decongest the prisons.
Swee, do you know if this is a conversation that we are having here in Malaysia among policymakers? Is this a conversation that's already begun?
To the best of my knowledge, no. This is not a conversation that's already begun. I think civil society has talked about this for very many years, I would say. So the lawyers, the legal fraternity, the human rights fraternity have talked about this for quite a large period. And I think there should be an unlikely coalition between, shall we say, the human rights practitioners and the legal practitioners, criminologists, criminal justice, and so on, together with the healthcare professionals. Right. Because that unlikely coalition is very important for very many reasons.
Okay, speaking, you began by saying our public health response is responsive and it's evidence-based, right? So when you look at this international situation and best practices, as it were, why isn't that being followed through? Why isn't this government looking at best practices around pragmatic solutions to very real problems and acting on them?
Well, that's a great question. A couple of structural reasons. I think the government is new, and therefore you're finding a footing with the bureaucracy and the civil service and getting the machinery of government, because when you get into government, you decide to pull a few levers of government, you realize nothing actually works. So I think we have to give them the benefit of some doubt. However, a lot of it is political will, as in if we don't have the political will, then we're not going to pull those levers hard enough. Imagine if the government actually wanted to do something, we'll be able to have very many conversations. And I'm glad that at some point we will talk about the issues that we're not talking about. And this is one of those issues that we're not talking about, what to do with custodial health. Because it's not just prisons, it's also detention centers, and what do we do about undocumented migrants and so on. So I arrive at these 2 very structural challenges, and maybe political will is the problem.
Well, you raised a good point, and we have about a minute left, and I do want to ask you that what are those conversations that we have not embarked on that we really need to start today?
Well, a short laundry list would look like the following. The first one would be undocumented migrants and how can we improve the health of their health while balancing national security and economy needs as well. We're talking 2 to 4 million people. Even with the best of resources, you can't just deport 2 to 4 million people overnight. So that's one thing we're not talking about. The second thing that we're not talking about would be what to do with the regional travel bubble and to restart intra-ASEAN trade and intra-ASEAN tourism, trade, economic development, and familial ties. The third and final thing, and I think this is a pretty good list already, the third and final thing is how does Malaysia get in front of the line for the vaccine? And what do we do about, for example, the COVAX facility for which 172 countries have already signed up, but not Malaysia, also not China and not the United States, but those are separate conversations. How does Malaysia position ourselves that we're early enough in the queue to get the vaccine if and when it comes? These are three examples.
Great laundry list.
Yeah.
And
Very quickly, could you tell us what that COVAX list, exactly what that is for our audience?
Sure. COVAX, or the COVAX facility, is one of 3 pillars of ACT. ACT is access to COVID tools, launched by the World Health Organization in April this year. It's designed to give the world 3 tools. The first tool is a vaccine. The second tool is the medicine or the treatment for COVID. The third tool is a test kit, so the testing facilities for COVID. And the vaccine, the treatment, and the test kits for COVID are the 3 pillars, are designed to, well, resolve problems of patents and intellectual property and access for 7.8 billion human beings, because if you have a pandemic somewhere, the world is not safe. A pandemic somewhere is a pandemic everywhere. We have to get the vaccines, the treatments, and the test kits to 7.8 billion people.
Okay, and you're saying Malaysia's not signed up?
No.
All right, well, that is a conversation that we need to have, another conversation on Consider This. Thank you for giving us more topics for the show, and thank you for being on the show tonight. We really appreciate your time. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.